Welcome to the Health Catalyst podcast, brought to you by YPO. Here we talk about the business of health innovation, and I sit down with industry leaders who have been in the trenches. My goal is to share the lessons and provide practical and actionable advice to help you launch, grow, and scale your business. I am your host, Rodrigo Hute. Hi, everyone, and welcome to the podcast. Today, my guest is Dr. Darshan Shah. Darshan is a health and wellness expert. He's also a surgeon and also an entrepreneur. He's the founder and CEO of Next Health, a health and wellness optimization and longevity clinic in the US. Darshan, welcome to the podcast.
Thank you for having me, Rodrigo. I'm very happy to be here.
I'm very excited about this conversation. I've been looking forward to this for a couple of months now. And let me ask you about the company that you started. I think it was like 10 years ago, Next Health. Could you share a little bit about the inspiration behind starting this company?
Yes, of course. So, it came from a few different things, Rodrigo, to be honest with you. What happened was I was working as a surgeon for 20 years, actually, when I first got the idea about Next Health. And the reason I got the idea was I personally was very sick. And so by that, I mean, I was 50 pounds overweight, which led to me also having metabolic disease. And so I had diabetes. I also had an autoimmune disease, and I also had uncontrolled high blood pressure. And I was having a lot of trouble just moving around, even with brain fog, with sleep, with stress, everything. I was on many medications, and like 8 different medications I was on. And I thought to myself, I really don't know how to be healthy. I was never taught that at medical school. So after realizing that I did not have the knowledge to get myself healthy, I decided to take some time off of my day job, which was being a surgeon, and go learn from conferences on the science of health. And what I learned was there was a new field of medicine developing called functional medicine. And I used the techniques in functional medicine, which is root cause medicine, on myself. And I became healthy within months. Within, I would say 8 months, I had completely turned around my health. I had lost all the weight that I wanted to lose. My autoimmune disease went away. I went from 8 medications to 1 medication. And I said, you know what? I want to practice this kind of medicine. I don't want to do surgery anymore. So over the next few years, I wound down my surgical career and I started doing functional medicine. And we started these new clinics called Next Health in Los Angeles. And turns out a lot of people wanted functional medicine. And so they started coming, and we opened more clinics, and then we opened a clinic in New York, and now we're opening over 85 locations all over the country. And it's been a great journey for me, not just for my own health and getting myself healthy, but also I see hundreds and hundreds of patients that are able to reverse chronic disease, to be able to finally feel good again, to feel vibrant again. And that's what's really inspiring about Next Health and what we're doing is people feel great. And when you feel great, you can do a lot of more things than when you don't feel great. So it's really inspiring to see people's health journeys.
Awesome. And congratulations for your journey and all the success that you've had so far with Next Health. I would agree with the functional medicine trend. In fact, I read somewhere that the functional medicine space has grown like 4 times over the last 10 years. What's really the difference between functional medicine, longevity medicine, preventive medicine? Is it the same thing, just with different names?
No, there are actually 3 different things. And so one of the things that we do at Next Health is we have an entire system. I actually call the system the wellness wheel that we take our patients through. And so the wellness wheel is a diagram of the 12 different aspects of your health. And what we tell people is this is a complete picture of your health. So let me describe that to you, and that'll be the answer to your question. The wellness wheel starts off with the basics, which is nutrition, sleep, and exercise. Without getting these 3 aspects of your health right, it's really hard to get your health in order, right? So we talk to people about the basics of health. Secondly, we move on to preventative medicine. Preventative medicine means using the best technology that is locked up in Western medicine in the hospital, but using it 20 to 30 years sooner. And we're doing that to prevent death from the major causes of why people die. Most people will die. If you look at the CDC's top 10 causes of death, it's either heart attack is number one, cancer is number two, number three is getting some sort of metabolic disease, and then you have strokes in there, and you have in there as well, number 6 or 7 is Alzheimer's disease, so neurodegenerative disease. All of these things are preventable chronic diseases. And so we are using all of the technology in Western medicine 20 to 30 years sooner, things like measuring biomarkers, full body MRIs, heart scans, etc. And we're preventing these diseases from showing up in the first place. So that's preventative medicine 3.0. And then we talk about functional medicine. So functional medicine, root cause medicine. Root cause medicine tells us that there is really 8 root causes of disease. And if you can optimize those 8 factors, chances are you're not going to get the hundreds of diagnosed diseases that are out there in the Western medicine world. And so we're looking at things like gut health, hormonal health, detoxifying your lifestyle, and also mitochondrial health. And those things, when you attack those root causes, it prevents other diseases. But the side effect of functional medicine is you feel incredible again. You feel young again. You feel like you have your energy back. You sleep great. You can keep fat off, all of those things. And then lastly, longevity medicine, the way I define it, is using some of the advanced technologies around supplements, medications, some therapies that we do like therapeutic plasma exchange to really move the needle of your health span. So really keep you healthier for longer and maybe even add a few years to your lifespan as well. And so that's where we look at longevity medicine. So these are all different aspects of health that I think, traditional medicine, it was never built to address any of these 4 aspects of health. It was built to diagnose disease and to treat you when you have a disease, right? So if you get a heart attack, if you get cancer, if you get hit by a bus, Western medicine is incredible at helping you with those things, but is not really built for the 4 things that I just talked to you about. And I think it's a parallel healthcare system from the Western medicine system.
Yeah. Thank you for that. So you mentioned that functional medicine, it's root medicine, right? Like really understanding the root causes of disease. And to do that, we tend to use biomarkers, right? Biomarkers are essential, in assessing someone's health. What type of biomarkers do you focus on more, or Next Health focuses more on more? And why every time I go to a doctor, they tend to focus on something different than what you would typically see if you go to a functional medicine doctor? Let me give you an example. If you go to a traditional doctor, and I'll give you an example. I have high cholesterol, right? And I have high cholesterol, and every time I talk to a traditional cardiologist, they typically talk about LDL, right? But I went to see a functional medicine doctor, and they talk about LDL, but they also talk about lipoprotein A and ApoB and other factors. So why is that? Why is it so complicated and confusing when it comes to biomarkers? And the second question is interpretation of the lab results an art or a science?
Mm-hmm. Yeah, that's a great question, Rodrigo. So let me tell you about first, what do we do at Next Health? So the minute you become a member of Next Health, we check your biomarkers. And so we're checking what we call our baseline, which is about 80 different biomarkers of blood biomarkers. And then we're also doing some genetic testing as well. Now, some people want to do more than that. And so there's hundreds of biomarkers you can check. And so sometimes we do what's called a functional medicine panel, which measures a few hundred biomarkers, including toxin levels, hormones, gut health, etc. Okay. Now, we always have a discussion with our patients about how much information do they want and at what cadence do they want it. Do they want everything up front, or do they want to do a few important things first and then slowly make their way through the process? And that's such an important question to ask people, because health anxiety is a real thing. And so we don't want to give people too much information, but we also know there's people that want everything done all at once, and that their personality is they want all the information now. And so I think that, you really have to understand what the patient is looking for. Now, to answer your second question, why does traditional Western medicine look at LDL versus functional medicine looking at ApoB, Lp(a)? Well, that's because most traditional medical doctors were educated 20 to 30 years ago when these biomarkers were not available, and they probably haven't kept up with the biomarkers and the research around them. I think functional medicine, we are so used to looking at biomarkers preventatively that we know that we want to prevent disease. So we're looking at new biomarkers that are done earlier to prevent disease. In traditional Western medicine, you're looking at when do you diagnose disease, because when you diagnose disease, you can then give someone a medicine for that disease, right? And so it's a little bit different mindset, because you're trying to figure out, when is this medication indicated? When is this procedure indicated based on this biomarker? All those indications are come up with doing research studies, right? And research studies were typically done, for example, on statins were done 10, 15 years ago now. ApoB was probably not even available widely back then, And so that's what they're looking at. And I think it's really important to understand that, like, your traditional medicine doctor, they are very well equipped to treat you when you have a blockage in your artery. However, if you don't have a blockage that needs treatment yet, what are you going to do in the meanwhile, right? Mm-hmm. And so that's why looking at these markers earlier that are more comprehensive, like ApoB, Lp(a), is important.
I get it. Okay. Got it. How does, related to the biomarker question, like how does Next Health utilize biomarkers to personalize treatment plans for your patients? Maybe you can share an example of that.
Yeah, absolutely. Okay, so I'll give you an example of metabolic disease, because I think it's the most important example. Metabolic disease is one of the root causes of all the other diseases. If you have dysregulated insulin levels and glucose levels, then what happens is you get a higher chance of diabetes, Alzheimer's, heart attacks, autoimmune, all of it. So we want to make sure our patients don't head towards metabolic disease. Traditionally, in medicine, they measure hemoglobin A1C, and when it gets to 6.5 or above, they tell you you have diabetes and you get put on a medication for diabetes, right? We never want to wait till you get diabetes. By then, it's already a lot of damage has been done. All of that process before you get diabetes takes sometimes up to 20 years to get to that place. So we're looking at earlier biomarkers. We look at hemoglobin A1C, of course, but we're also looking at fasting insulin levels, for example, okay? Fasting insulin changes first. And so we want to keep that level optimized to 10 or less. And so if it's above 10, then we're going to put you on a continuous glucose monitor so you learn how to manage your glucose levels on a day-to-day basis. And so that's one example of using a biomarker to then institute another piece of technology that can help you avoid metabolic disease 20 to 30 years before you get diabetes, right?
Yeah, that would be a good example of prevention.
Yeah.
Let me ask you a question around efficacy, evidence of efficacy, and you already touched on this. That at the most, you talked about this circle
wellness wheel,
the wellness wheel, and I was going to say we all know, but let me rephrase that. Most of us know that, for example, lifestyle factors such as diet, exercise, sleep, are the baseline, the basics that you need to do in order to be healthy, and then you can add on supplements, you can you can take certain medications and so on. How do you, when you think about impact, like to someone's health, how much of an impact does lifestyle things like diet, sleep, versus supplements versus medications impact someone's health? And I know this is a very broad question, but my question has to do with incrementality and attribution. Like if you were to allocate how much of each of the different tools that you're using or you recommend to a patient really impacts someone's health, to really understand the efficacy of each independent tool, if you will, or
Yes.
strategy or tactic. Do you know what I'm
Yes.
saying?
Absolutely. Yeah. So I always focus on what's called the Pareto principle. What are the 20% of actions that you can take that will move the needle 80%, right? And so
Right.
I think that's super important to look at. And if you look at all of the different interventions, the 12 different aspects of health that I told you about, Rodrigo, you could stack them up as a pyramid as well. And the base of the pyramid is always going to be nutrition, sleep, and exercise. Okay. That's what's going to give you the most bang for your buck in your time. Like you said, most people know they're called lifestyle factors. But what people don't know is in those categories, what's going to move the needle the most. And sometimes it's not as intuitive as you think. So, for example, with nutrition, a lot of people stress out about what macro ratio they're eating. Okay. That's actually not that important. What's much more important is to eliminate ultra processed food from your diet completely. The minute you eliminate ultra processed food, I almost don't care what your macro ratio is. You're going to be healthier. Okay. So that's one example. Another example is in exercise. A lot of people stress out about what is their gym routine, how much strength training versus cardio, what kind of cardio, do they do HIIT? But that's not that important. Whether you go to the gym or not, if you do one thing, is going to make much more of a difference, and that is to eliminate sedentary behavior during your day-to-day. Okay? So first thing you got to do, I don't care if you go to the gym or not, the first thing I'm going to talk to you about is your 8 hours a day at work. How are you moving around? How are you incorporating movement into your day-to-day routine? Or are you sitting there in front of your computer for 4 hours, getting up, sitting down for lunch, and then getting up, and then another 4 hours of sitting down? That's much more detrimental to your health than going to the gym is going to improve your health. In fact, going to the gym for an hour a day cannot counteract the negative effects of being sedentary. So those are the kind of pieces of advice that we give to our patients around each one of the different wedges of the wellness wheel. And once we get that right, then we can kind of move further down the rabbit hole. And so that's how I look at the incrementality of it and also the efficacy of each intervention.
That's great. So what you're saying, from an exercise perspective, what you're saying is that don't sit down for too long. Like you have to do something, like walk a little bit, take a call while you walk. Is that what you're saying? Would that be a practical example?
In fact, the science is pretty robust on this topic, Rodrigo. The effects of sedentary behavior, for every hour you spend sedentary, after 4 hours, you get a 15% chance of increased all-cause mortality. And so the way to counteract that is by doing something that is termed an exercise snack. That is, every 45 minutes of being sedentary, you almost want to set an alarm, like an egg timer or on your computer or your phone. Every 45 minutes it goes off and you get up, and for 5 minutes you do some kind of physical activity. You can start off with walking and taking a phone call, or what you can do is some jumping jacks or lift some weights or do some mobility exercises. That's what's really going to counteract the negative aspects of being sedentary throughout your day.
Yeah, I'm going to do that. I'm going to start doing that. And what would be an example of those ultra processed foods that you will tell people to stay away from this? This has one of the biggest impacts on your nutrition.
Any of the packaged desserts and snacks that you see in the center of the supermarket. So things like packaged chips, packaged cookies, packaged cakes, anything packaged with a bunch of ingredients that are added, that's not real food. What that is a concoction that was created by a food company to sell to you, to convince you that this is going to make you less hungry. In fact, it's designed to keep you hungrier and eating more, because they want you to buy more, of course, right? And so they make that as cheap as possible as well. So the lowest cost ingredients are usually chemicals put together, and they're sold to us as food. And so anything in packaging fits that category. Unfortunately, a lot of restaurants and a lot of, especially fast food restaurants, used ultra processed food to make the food that they serve you. So that's another big category, is to stay away from fast food restaurants and restaurants that don't serve high quality food.
Yeah, right. Let me switch gears a little bit. So Next Health, it's a network of retail clinics, physical clinics. And I wanted to ask you about, why did you choose the physical clinic model versus telehealth versus a hybrid model where you have telehealth and some in-person treatment, whether at a clinic or at home. What was your thinking behind that, and what do you think about the pros and cons of both models?
So we actually are a hybrid model, Rodrigo. We do a lot of telehealth, actually. However, there's a couple reasons for this. Okay, so number one is the practice of medicine laws in the United States say that you can only practice medicine in the state that you meet the patient, okay? And so with the telehealth model, you either have a doctor that's licensed in all 50 states, which is very rare, or you have multiple providers that are doing telehealth. I think telehealth is great for many things. However, the problem that people have with their health is that they're not in a routine about their health. Health is all about routines. And so we wanted to create a physical space that was inspiring for people to go to on a routine basis to do something about their health. We basically wanted people to rethink their health completely. It's really hard to do that through telehealth. When you come into a Next Health location, it looks like, people call us the Apple Store of health and wellness. It's a beautiful space. And you can do things. We have what's called a longevity circuit, that you can do hyperbaric oxygen therapy, followed by sauna, followed by infrared light, followed by cryotherapy. You can do IV nutrient therapy. You can do other technologies that we have at our locations, and you can meet physically with someone who's going to talk to you about your nutrition, with your doctor. And we develop a community in these spaces. We have talks. We have people come and see each other there that know each other. And then it becomes a social time for them to sit there and get an IV together. Or they go in the sauna together. Or they go into the hyperbaric oxygen chamber together. And so I thought it was really important, not just to create a business model, but to reinvent healthcare. And so with Next Health, I wanted to reinvent healthcare. And my step one to do this was I sat down with a napkin and I wrote everything wrong with healthcare right now. I think one of the big things that is wrong with healthcare is that it's so uninspiring to go to a doctor's office because it just feels like disease. And so we want to create an inspirational space. The other thing is people get more and more disconnected. A big part of health is community and feeling connected. And so I think, telehealth, unfortunately, I think it disconnects people more from the community aspects of health. And so that's a reason for creating a space. And so, a lot of people thought I was crazy creating a 4-wall clinic because they're expensive and they require staff, et cetera, et cetera. But I love it. I think we've created something very special and beautiful. And we're opening many more locations. And so I feel like people are really taking to it.
Yeah, absolutely. And I would agree with the habit formation piece that you just mentioned. I think that it's most of us, are not necessarily great at sticking to a regime, and you need a helping hand for sure.
Yes.
Let me ask you a question about stress management. I think you didn't touch about you touched on about sleep, nutrition, and exercise, but stress management, it's a crucial component of health in my opinion. How does Next Health approach stress management, and what are the most effective treatments that you have seen out there? Because there is a lot of noise in terms of what to do to reduce stress or manage stress, from supplements and therapy. There is CBD oils as well, kava. There is a bunch of products out there. So I would love to get your take on how Next Health approaches that.
Yeah. It's really, I think stress management is one of those topics that really requires human to human interaction to really customize a program for someone that's going to work for them and their lifestyle. I definitely don't think there's any supplement that's going to overtake your stress management system to such a degree that if you are having negative effects of stress in your life, the supplement's not going to take care of that. CBD is not going to take care of that. You gotta incorporate a few thought processes into your day-to-day that help you manage your stress. So those are, number one is recognizing that I think this whole concept of eliminating stress, it actually causes more stress because no one can eliminate all their stress. If you're living a completely stress-free life, you're probably not doing all the things that you want to do, And so I think it's more about mitigating negative stress. And so what I mean by that is you have to find out what in your life is causing you a lot of negative stress. Maybe it's a bad relationship. Maybe it's your work. Maybe it's something going on with your children. Those things that are going on, you have to actively try to address those big rocks of stress in your life. Okay. That could mean therapy. That could mean lots of different things. But being honest with yourself and looking in the mirror and saying, what is causing my stress right now? And how do I actively address those? It's not getting rid of the stress that's going to make a difference. It's actually actively addressing it, doing something about it day to day, week to week, month to month. That's going to help, right? Financial stress is a big stress for people. You're not going to fix financial stress in one day, right? But as long as you're actively doing something about it, maybe you're going to school so you can learn a new career to get a new job. There's hope at the end of the tunnel that this stress won't be there anymore. Okay, second aspect of stress is self-care. Most of the times when we're stressed, what we do is the last thing we think about is ourselves, and we don't take care of ourselves. And so at Next Health, by providing a place for people to go, and for 1 to 2 hours, once a week, they get to practice some level of self-care and disconnect from their day-to-day stress and feel like they've done something for themselves. It's really beneficial to your stress levels. Thirdly, day-to-day, there's a couple things that people can do to manage their stress. Number one is you have to start your day off right. And that means getting into a good morning routine. And I don't mean of course, physically going out into the sun, getting the sunlight, all that is great. But setting your mindset right. The opposite of getting your mindset right first thing in the morning is checking your phone first thing in the morning. So I encourage all my patients to take their phone and put the charger in a different room. Don't allow your phone to be the last thing you see at night and the first thing you see in the morning. Second aspect of stress management throughout today is having a morning routine that includes visualization, includes some gratitude practices, includes some breathing techniques. It only takes 5 minutes to do all of this. Putting that in day after day makes a big difference. Lastly is what I talked to you about earlier. Every 45 minutes, taking a break from whatever you're doing at that moment in time and changing your mind a little bit. Maybe you do a little exercise snack. Maybe you go for a little walk in the office and talk to somebody. That helps your stress levels, the mental stress, not turn into physiological stress. Physiological stress is your cortisol level going up, causing your blood pressure to go up, causing your metabolic metabolism to slow down, all of that. So interrupting that cycle of mental stress to physiological stress by taking a break every 45 minutes for 5 minutes can make that happen.
Nice. Yes, I like it. I love it. I'm gonna implement, many of those recommendations. Thank you.
Awesome.
I have a question about testosterone and, and hormone replacement therapy. There is, all of a sudden, I don't know how long this has been, but all of a sudden, over the last few years, I've been hearing a lot about, hey, having low testosterone is bad. Now there is a big trend towards, injecting yourself with testosterone and having this, hormone replacement therapy. And there's a number of players out there. There is some clinics that focus on testosterone for men's health. There are some telehealth providers as well, and so on. But, my first question is, is there evidence of efficacy and safety on testosterone therapy? And the second one, is there a clear cut in terms of the numbers? Like, when is it really necessary versus a nice to have? Because I hear a lot of people say, well, you may not have low testosterone because you're within range, but you should have it anyways. And that's kind of confusing. It doesn't feel like clear cut. So
Yeah,
what's your opinion?
Yeah, let me make it very clear for you. So let's talk about male testosterone therapy first. Men go through andropause, which is their testosterone level just genetically starts falling, is due to a combination of genetics and also lifestyle. Okay, both things come together to make your testosterone levels go down. The research is extremely clear that low testosterone levels leads to less muscle, more fat, higher risk of cardiovascular disease, Alzheimer's disease, cancer, all of it. Okay. So having an optimal testosterone level, I think, is now accepted medical recommendation, right? However, that doesn't mean you need testosterone therapy. What it means is you have to look at your lifestyle and what are the things that you're doing to cause your testosterone levels to go lower other than just aging. Right. And so a lot of people are eating a lot of ultra processed food. They have inflammation in their gut. They're not getting enough sleep. They are sedentary all day long. They're very stressed. All those things will lead to lower testosterone levels. So optimizing along those factors is helpful. However, also as we age, our testosterone level goes down. Right. And so your second question was your testosterone level is normal, but you should do it anyway. Well, when they're telling you it's normal for your age. So those numbers by age, remember all the normal levels that people give you, they give them to you because that's normal for other people in that age group. Okay. Mm-hmm. But it doesn't mean that that's optimal. What's optimal testosterone level is what your testosterone level was when you're the healthiest time of your life, which is usually like in your mid to late 20s. Okay. Most people don't know what that number is, but it's somewhere around 400 to 800 for men. Okay. All of this that I'm saying is true for women as well. So if you're not 400 to 800, chances are, number one, you're going to have symptoms of low testosterone. So if you have symptoms, you might want to consider treatment. Or if you want to avoid disease, you might want to consider treatment as well. Okay. And so we also do testosterone therapy for men and women. We also do estrogen and progesterone therapy for women as well. It's extremely important, I think, in modern society to consider this if you need it. And I think it's very important to work with a very skilled provider. I don't think it's a good idea to someone who's not managing your overall health to be prescribing you hormones, because hormones are part of your overall health program. And so, like you said, there's a lot of clinics that all they do is give you testosterone, or there's a lot of online places. I think that's probably not the right approach. You want to address testosterone therapy in a bigger context. You want to address it in the context of what is your risk of cancer? What is your risk of metabolic disease? Has someone looked at your prostate levels? Testosterone can actually prevent prostate cancer, but if you have a big prostate already, or you have prostate cancer, it can stimulate your prostate to grow. So you have to be careful. The other thing is you have to look at it in relationship to metabolic syndrome as well, because metabolic syndrome can cause low hormone levels as well. So those are all things that play together, and it's interwoven into a complete health strategy, not just an individual kind of therapy from one place.
Yeah, it makes sense. Thank you for that explanation. Darshan, I have one more question before we go. I could stay here for another hour and ask you more questions, but let's do one more. And that is, what are some of your favorite biohacks or habits that you have adopted in your life over the last 5 years or so? That you already mentioned a few of those, over our conversation, but what are your favorite biohacks or habits, whatever you want to call it, to live a healthier life?
I'll give you 3 of my favorite things I'm doing right now. Number one is I bought a cold plunge at home, and I'm loving cold plunging. I do it almost every day when I'm not traveling. So that's been fun to have just one at home, and it's ready to go whenever I want it. Secondly, I would say is, I'm taking some really cool new supplements. One is called urolithin A. It's by a company called Timeline. And another one is called nicotinamide riboside. It's like a form of NAD by a company called Chromadex. Those have really improved my energy levels because they're mitochondrial stimulants. And thirdly, I would say is I've added a new form of exercise that I really am enjoying. It's called rucking. Rucking is where you take a weighted backpack and you go for a hike outside, up and down hills. And I live in Malibu, and so we have great hiking here, and putting a rucksack on, it's just fantastic because you get all types of exercises all together while you're outside. It's strength training, it's mobility, it's, all of it together. And it just, and you're outside and you're in nature, it just feels great. So I would say those are three things that I've been doing lately that I really love.
Great. So you literally add rocks to your backpack?
I have this thing called a Go rucksack. And so it's a backpack, and they actually have these weights that you put in that are like 30-pound weights you put inside the backpack. And it's more comfortable than having rocks in your backpack.
For sure. Yeah. Okay. Thank you for sharing that. Darshan, thank you so much for your time today. Thank you for sharing your wisdom, your experience. Congratulations for Next Health. And I wish you all the best to you and the company. And thank you for being here today. And also, thank you everyone who is watching and listening. Thank you for watching, and until the next time.